Andrew, so great to have you in the podcast. How are you today?
I'm doing great. Pleased to be here.
Yeah, really excited. You and I were chatting a little bit. We've definitely crossed paths a while, but it's great to finally have you on the show. Especially as we've done over 1,000 like episodes across the network, but I think we're getting ready for this to be close to episode 500.
Fantastic.
Yeah,
It's an
it's
achievement.
been fun. Yeah, thanks. It's been fun. And I'm really excited to have you on now finally too. So this is great.
Likewise.
Let's kick things off. Since it's your first time, let's assume there's a small percentage of people who follow us that are just getting to know you. So tell them a little bit about yourself and Canvas Medical.
Sure. Yeah, I'll start with me. Let's see, I've been working on Canvas for just about a decade. Founded the company in 2015. My sort of formal training is in computational math and engineering. I was in a previous life a PhD student at the Stanford School of Engineering. Didn't finish the PhD, sort of had Silicon Valley calling, so to speak. Um, and pretty quickly went into health tech. My first role out of grad school was in hospitality technology of all things. Um, but it was very cool because we were putting sort of building statistical inference models, not LLMs. This was pre attention is all you need, which was that seminal 2017 paper that sort of gave rise to the LLMs as they exist now. But we were putting inference models and optimization models in production enterprise software. And in 2010, 2011, 2012 for hotels. And that was just intellectually so fascinating for me. Um, but it didn't have the human impact that I had always sort of dreamt that my career or romanticized that my career might have. And my girlfriend, who became my wife and is my wife now, um, was in the School of Nursing at Johns Hopkins and exposed me to enterprise software and care delivery, aka EMRs. Um, and I sort of instantly knew that this was going to be a an area I wanted to dedicate a big chunk of my life to, if not all of it. And so went to Practice Fusion, if you may recall that brand. It's now under Veradigm. Back in 2014, met some phenomenal people there I'm still connected with in big ways, and then started Canvas in 2015 and much more. I think there's real questions about what is an EMR. So the way we see it is the goal is to be the EMR that accelerates everyday medicine, not research medicine in academic medical centers, but everyday medicine across all ambulatory medical specialties: asthma and allergy for kids, dementia care and seniors, gut health for middle-aged professionals, in-person telehealth, you name it. We do it. Our customers do it. And Canvas is the software platform that their doctors and nurses and business managers and staff use to do their work better, more efficiently. And then critically, there's another user that's quite unique to Canvas. I mean, more platforms now, but for us, and that's the developer. The developers used Canvas tooling to improve the software, customize the software, integrate and develop AI for use in care delivery. And that's sort of our um, 10 years to get there. The vision, even back at Practice Fusion, was not terribly different, but the technology and the tools had to.
What is something you wish people knew about Canvas Medical, but you think they don't know about?
What a great question. I mean, one is it's sort of been, I think, associated with digital health, which I still don't know what that means after 12 years and I guess doing it. But our first practices were, I flew to the Panhandle of Florida to implement our first practice in with full platform in 2018. Brick and mortar primary care clinic, Panhandle of Florida. Second practice was in the San Juan Islands, brick and mortar practice serving seniors in Part B and Medicare Advantage seniors. So that would be the thing. Canvas is for all settings of medicine, not just this, not to discount telehealth at all, but there are limitations to what can be done in this interaction. And from the very beginning, Canvas has been built for that sort of multi-setting practice. And the second thing is, um, I think people are just now really understanding what can be done with the developer tools, in particular in development of AI agents and copilots. It is surprising even to our own developers what we're able to do with those tools, how much context we can bring to bear, how effective we can be in optimizing workflows, automating workflows. Um, Once you start to get your hands on it, it's the world opens up and you start, uh, you sort of let go of assumed constraints and it becomes a very different game.
It's interesting. I don't actually I did for a while. I don't really like the term digital health anymore because shouldn't all of healthcare have a digital health component, right? Like this isn't 50 years ago. Everything should have some digital component to what they're doing or you're doing something very, very wrong.
No question. No question. Yeah. I
Yeah.
mean, there was is digital care delivery is I've heard some folks use that term as well. It's all, it's sort of like email. I think, yeah, we get paper mail still, but I call email is just mail, right? It becomes anachronistic.
Hmm.
And I think we're there with digital health. But you can be pedantic. I can be pedantic at times. And
The email is a good example. I mean, email, text, phone call, it's all a form of it's just a communication. So when you talk about digital care delivery, right? It's care delivery. It's just the digital way of providing it. But you don't create a whole new. I think we do this in every space. We do this far too often in healthcare is we have all these different buckets and then let's make more buckets of what are you doing? Love that mug, by the way. I need a slice of healthcare mug or something to
yeah,
incorporate into my.
the trouble
Anyway,
is we put the logo on the wrong side 'cause I'm right-handed, so I would normally, but for you, I got to do this. Right, here we go.
there we go.
Yeah, no, I think well, there's a I think a reasonably understandable motivation for it, which is the more that a vendor or a competitor or a supplier in a market can try to differentiate themselves, uh, the better off they are, and so that leads to a sort of arbitrary and meaningless segmentation. And when there's a new thing to sell, hey, there's a new problem that you have that you didn't know about, or a new market segment that you didn't know about. So just kind of see through it and ignore the noise.
Hmm. That makes sense. Andrew, talk me through just what people have been saying. Obviously, you've been at this for you're not this startup with unproven stuff. You've been doing this. You have results. Is there any particular case study or just examples that you can share with us today of what people are saying?
Yeah, I mean, I think the outcome that we are most pleased with and focused on, um, and have been for really since 2021, which is when we released our developer tools. We spent years, and tens of millions of dollars building what we call core platform, and that's the medical record system with federal certification the right way. There's a way to get federal certification the wrong way. That will catch up to you. You do it the right way. It takes a long time. Um, and then, from the beginning, we were building internal software development kit tools that were very modular that our team could use to move quickly. And then in 2021, October 3rd, I'll never forget the day, we released the first set of those tools. In December 2024, so 3+ years later, and just 4 or 5 months ago, we released the general availability of the full set of the software development kit. And so in that journey of going from those first tools in 2021 that help developers and product managers optimize workflows, find friction for care teams, and remove it, we have seen the cycle time of problem identification or friction or automation opportunity. You start the clock, right? Okay, what is it? It's a prior auth, or it's scheduling follow-ups, Why does scheduling follow-ups, for so many cases with a practice that has a panel of patients you're going to follow over time, you're going to schedule follow-ups. Why is it so difficult? Why does it take really any work at all? Is a reasonable question. And so once you identify that problem, how long until you get a serviceable solution? We've seen that cycle time shrink to now we're solving problems the same day. Our customers are solving their own problems. Classic error on my part here. This is an unforced error. The Bluetooth connection to the phone with the spam call takeover, right? Just put it in the bloopers reel. Um, but that cycle time, it used to be, and I think for many systems, it still is, many enterprise systems, you file a ticket, you leverage, you apply some leverage to the platform for them to make some change for you. And then maybe a quarter later, or a year later, in some cases, for the worst offenders, you get an improvement. Um, and so when we're seeing sub-day automation, sub-day, what we call plugins or extensions, right? We have customers that have getting close to 100 proprietary extensions that make Canvas really sing for them. And they're building them in matters of hours. And so we see that as sort of them taking their model of care, how they um, diagnose and treat and manage the operational side of care and moving it into software so that it can be automated and improve over time. And so I think that compounding, that cycle time is really critical. It's really, really critical. And that's how practices get better. That's how patients get better care. And if there's that rate of improvement, I think matters more than anything else because no matter how far a practice is from their idealized care model, if they're able to iterate quickly on that care model, they get there. And that's the goal.
I know you can work with a bunch of different practice types, right? But if you had to bucket, like which practice types are you seeing maybe using Canvas the most right now, even when you can work across more than those? But would love to hear, who are the main users?
It's an unconventional way of looking at care delivery organizations. I'll say that off the bat. We don't see the world split by specialty, like modernizing medicine example, very, very large player in the space, and their products are, some of them are built in-house, some are through acquisition, but they're dedicated to specialties, gastroenterology, plastic surgery, orthopedics. Um, what we care about more than anything, and what we see uh, really work the best, where we know Canvas is going to change the game for them, um, is practices in medicine, so not surgery. We don't support ambulatory surgery centers, and we don't support hospitals. We don't do acute care. So ambulatory medicine, where they have a strong opinion about their care model and they want to deliver care differently. That's like requirement number one. They have to have. We're not experts in medicine. We're experts in the software for medicine, right? And so they bring that vision for what their care model is. This is how we want to manage our panels. This is how we want to diagnose and treat. Um, that's criteria number one. Criteria number two, obviously they have to have, and they almost always self-select this way, a belief that software and AI is an important part of succeeding. Um, and then they tend to be somewhere between 10 and 300 clinicians to start out with typically a switch. We do plenty of starts, but larger enterprise switches from a legacy system or even a false start on a quote unquote modern or new system that didn't meet their needs, after 6 months, 12 months, whatever that is. 10 to 300 docs tends to be a good range for us, where our team has got that proven track record of successfully doing those switches and migrations. Um, and and that's it, man. It's, you got to bring the opinion about how you want to deliver care. You got to bring the approach or the attitude that you're going to cycle on that with software and AI, and you're going to push out costs from your practice to become more profitable and be more competitive in your market. And then, not too small, not too big. And then what tends to happen is those companies, they succeed and they grow, And then we start supporting larger and larger switches. So switches is a big part of our practice. It's a very difficult capability for a company to develop. I mean, I think I lost quite a bit of facial hair over the over the years from the stress of it's sort of grown back in, but still a little bit scrappy looking. The stress of a switch can be really significant. And so having done that so many times now, we really see that brownfield opportunity, so to speak, of folks that need to leap into the future. They know AI is going to change medicine. They're not quite sure how to integrate it or develop it, and they see Canvas rightfully as the way to secure that future.
I love it. What's before we wrap up here, Andrew? What's next for Canvas?
I mean, more of that. I mean, more of more development of co-pilots and agents from such a broad array. We're deep in a lot of these different disease categories, patient populations, oncology, renal disease, pediatrics, geriatrics, dementia. There's a lot happening in terms of innovation in dementia care, and we're gonna see a very nonlinear expansion of sort of AI powered automation or acceleration in, yes, the administrative part, but also in decision support, diagnostic support, treatment planning. And I think it's uh, it's a homecoming for us. Many of the Canvas team is very long tenure, has been on the journey for a long time, and we see that passion sort of increase as we get closer and closer to the vision that we started out with 10 years ago. So, I mean, I think for us, we all feel this sense of, despite everything going on in the world, a real optimism and brightness, um, and a real privilege to be able to support the care delivery organizations that are pushing medicine forward for their patients. It's a really special place to be, and the future is just, uh, it's cool to feel like we're living in the future.
I love it, Andrew. I'm glad we finally did this. It's awesome to have you on the show. Let's definitely stay in touch. Would love to have you back on in the near future. But it's super exciting what you've built at Canvas Medical and what you're continuing to build, and look forward to definitely staying in touch.
Awesome. Thanks, Jared. Great to connect.